Hello friends, let us now learn some important differential diagnosis of focal consolidation. So, here, what are the differential diagnosis of focal consolidation? So, if you see, consolidation occurs, as we have already seen, the consolidation occurs when the alveoli which are present, these are mainly filled with air. If these alveoli which are filled with air are replaced by either water, blood, or pus, or cells, then this will result in focal consolidation. Now, first, if the alveoli are replaced by water or edema, so when alveoli are replaced by water or edema, here it can be whenever there is some patients with pulmonary embolism, where the patient has pulmonary embolism. Here, if this is the lung, and if you magnify this part, you will have alveoli, okay, and you will have the blood vessels which are present here, okay, some small minute arterioles or arteries, whatever you think. Now, whenever there is this obstruction of pulmonary artery, so the blood cannot flow. So, as a result, the distal alveoli would not get the gases which are required for its gaseous exchange. So this will not happen, and as a result, here there will be pooling of blood. So because of the pooling of blood in the proximal part, before proximal to the obstruction, because of the pooling of blood, so this arteriole will dilate, whereas this artery will constrict because of absence of blood. So when it dilates here, because of high lots of fluids, this will cause increase in hydrostatic pressure. So because there is increase in hydrostatic pressure, because of increased fluid, there is increased hydrostatic pressure. This will result in water to flow from the dilated part proximal to the obstruction into the alveoli. So now the alveoli is filled with this water, resulting in consolidation only in a particular focal part, whereas the other parts which are normally supplied are clear. Then there is a syndrome called as Weyer. Okay, there is a syndrome called as Weyer James syndrome. In this Weyer James syndrome, there is smaller lung. Along with that, there is obliteration of pulmonary vasculature. So this is here the pulmonary vasculature is obliterated. So this mechanism or pathogenesis is almost similar to the obstruction in the pulmonary arteriole. Even here, whenever there is obliteration of pulmonary vasculature, the proximal part will become dilated and the obliterated one will be obliterated. So this part will have increased hydrostatic pressure. So there is flow of fluid from the dilated part, which is patent pulmonary arterioles, to the alveoli, resulting in pulmonary edema. Similar to hypoplastic pulmonary artery, if there is hypoplastic pulmonary artery also, it is the similar way. Then it can also occur due to pulmonary vein occlusion, which has the similar pathogenesis. Then it can also occur whenever there is atelectasis with drowned lung. Obviously, whenever there is drowned lung, the water from the enters directly through the airways when the patient aspirates the water, it's yeah, when the patient aspirates the water, so the water enters the trachea, from that to the smaller from to the bronchi, then smaller bronchioles, and finally to the alveoli. So when the blood enters, sorry, when the water enters from the trachea to the bronchi to smaller bronchi, then bronchioles, and finally it fills into the alveoli, resulting in pulmonary edema, or actually resulting in consolidation. Okay, next. Whenever a patient aspirates something, like whenever a patient aspirates anything, bland aspiration, even in aspiration also it is a similar pathway. Right? Now, next. This is whenever the lungs are filled or alveoli are filled with water. Alveoli can also be filled with blood in consolidation. If there is any contusion is if this is the lung and if this is the chest wall, when there is any external injury to the lung and chest wall, then it can result in contusion. Or if there is any infarction to the lung, or if the patient has any type of aspiration of blood, or if the patient suffers from any type of vasculitis. So all these are the causes where the alveoli are filled with blood. Then alveoli in consolidation, alveoli may be filled with pus also, like any types of pneumonia. All types of pneumonia can be bacterial pneumonia, where the alveoli are filled with pus, can be tuberculous pneumonia, or atypical tuberculosis pneumonia, or fungal pneumonia, viral pneumonia, or pneumocystis cerevisiae pneumonia, or it can be some aspiration pneumonia, or it can be atelectasis with post obstruction pneumonia. Can be atelectasis with post obstruction pneumonia. In all these types of pneumonia, obviously there is some infection. So the alveoli here are filled with pus because of the infection. Then the next type is the alveoli might be filled with cells. That means if this is the alveoli, the whole alveoli is completely may be filled with cells due to cellular growth. The air is replaced by cells. It is seen in some types of neoplasms, like it is seen in pulmonary adenocarcinoma. It is seen in pulmonary adenocarcinomas, or it is seen in some lymphomas. Then it is seen in eosinophilic pneumonia, or it can be seen in some organizing pneumonias. It is also seen in sarcoidosis. So in all these conditions, we see the alveoli filled with cells. Then alveoli can also be filled with lipid substance, which is seen in lipoid pneumonia. In lipoid pneumonia, the alveoli is filled with lipid substance. So these are the differential diagnosis of focal pneumonia. Thank you for watching.